Principles of drug therapy, pharmacotherapy. The primary goal of drug therapy is to achieve a maximal therapeutic effect with minimal toxicity. This is the foundation of rational therapeutics. 1. Fundamental pharmacologic pillars. Drug therapy is governed by two main interactions. Pharmacokinetics, PK, what the body does to the drug. ADME, absorption, distribution, metabolism, and excretion. Bioavailability, the fraction of the dose that reaches systemic circulation, 100% for IV. Half-life T_1/2, the time taken for the plasma concentration to reduce by half. Determines dosing frequency. Pharmacodynamics, PD, what the drug does to the body. Mechanism of action, how the drug interacts with receptors, agonists versus antagonists or enzymes to produce an effect. Therapeutic index, T, the ratio between the toxic dose and the effective dose. Drugs with a narrow T, for example, digoxin, warfarin, require strict monitoring. 2. Core principles of rational prescribing. To ensure patient safety and treatment efficacy, every prescription should follow these 5 guiding principles. Factors modifying drug action. No two patients respond to a drug in exactly the same way. Always account for age. Neonates and the elderly have reduced renal hepatic clearance. Organ function. Renal or hepatic impairment requires dose adjustments. Genetic variation. Pharmacogenetics can explain why some patients experience severe toxicity at standard doses. Drug-drug interactions. Always screen for polypharmacy risks when adding new medications. 4. Clinical documentation and safety. As a practitioner, your documentation is your legal and clinical safeguard. Generic names. Always prescribe using generic names to avoid confusion and reduce costs. Clear instructions include the dose, route, frequency, and duration. Patient education. Ensure the patient understands why they are taking the drug and what side effects to watch for. Clinical pearl, before starting a drug, always weigh the risk versus benefit. If the anticipated risk, side effects cost exceeds the expected benefit, reconsider the therapy.